All right, today we're going to jump into an eye condition called keratoconus. We're going to break down exactly why it can make your vision feel like it's constantly changing, how doctors actually figure out what's going on, and some of the really innovative ways it's treated. So yeah, let's get right into it.
So, have you ever felt like your glasses prescription is just never quite right? You get a new pair, and then a year later, maybe even sooner, things are all blurry again? Well, that frustrating cycle, that feeling of your vision constantly shifting, that's a super common starting point for people who end up with a keratoconus diagnosis. It's often the very first clue that something a little more is happening.
So here's how we're going to break this all down. First, we'll talk about those initial blurry vision symptoms. Then we'll peel back the curtain and see what's actually happening to the eye itself. After that, we'll look at the detective work your eye doctor does to diagnose it, we'll go through the whole treatment toolkit, and finally, we'll talk about what it's like to live with this condition for the long run.
Okay, let's start right at the beginning. The mystery of blurry vision, and the common symptoms that get this whole journey started.
The classic story with keratoconus is this slow, steady, but really noticeable decline in vision. And what makes it so different is the timing. It often kicks in during the teenage years and can keep getting worse well into your 30s or even 40s. So we're not just talking about needing slightly stronger glasses every few years. No, this is that frustrating cycle of getting a brand new prescription only to find out it feels wrong again just months later. And that's because the actual shape of your eye is changing.
So, if it's not just your typical vision loss, what's the real culprit here? Well, let's jump into our next section and unmask this cone-shaped cornea to see what's really going on at a structural level.
And here it is. This is the heart of the matter. Keratoconus is a condition where the cornea, that clear dome-shaped window at the front of your eye, it starts to thin out and bulge forward. Instead of a nice, smooth sphere, it forms this cone-like shape. Think about it like a basketball that's slowly developing a pointy tip on one side. It's that irregular shape that messes with the light coming into your eye and makes everything blurry.
So how in the world does an eye doctor spot this? Well, they're looking for these critical signs. The big one is something called irregular astigmatism. This isn't your normal astigmatism. It's vision that's so distorted it's like you're looking through a warped, wavy piece of glass, and regular glasses just can't fix it. They can also see physical clues under a microscope, like these tiny stress lines called vogued stria, which show the cornea is literally under strain. And when they shine a light into the eye, they see this weird scissor reflex. It's a really unique reflection that only happens because of that distorted cone shape.
And there are other telltale clues too. A doctor might spot something called a Fleischer ring. It's this faint ring of iron deposits that actually forms right at the base of the cone. And then there's the Munson sign, which is pretty wild. When the person looks down, that cone-shaped cornea is so pronounced, it physically pushes the lower eyelid outward, creating this little V shape. It's a dead giveaway.
So what causes this? Well, it's linked to a few different things. There can definitely be a genetic component, so if it runs in your family, that's a risk factor. It's also connected to certain conditions like Down syndrome. But, and this is the big one, the one you can actually do something about, it has a really strong connection to chronic eye rubbing. That constant physical pressure is thought to weaken the cornea over time, so that's a huge takeaway.
Okay, so we know the signs and symptoms. How does the doctor put all these pieces together? Let's get into the eye doctor's detective work and look at the specific tests they use to confirm the diagnosis.
The whole diagnostic process is really methodical. It always starts with just talking, your history, your symptoms, those risk factors like eye rubbing. Then comes the slit lamp exam, which is basically a super powerful microscope for your eyes. That's where the doctor can see those tiny details, like the thinning and the stress lines. The refraction test, which is better, 1 or 2, that's what reveals that classic irregular astigmatism. But the gold standard, the final piece of the puzzle, is corneal topography. This machine creates a detailed 3D color map of your cornea surface, and on that map, that cone shape is just impossible to miss.
Now, an important part of the diagnosis is making sure it's actually keratoconus and not one of these other rare conditions that also cause the cornea to thin out. And really, the key difference boils down to one thing: location, location, location. With keratoconus, the thinning and the bulge are happening near the center of the cornea. But with something like pellucid marginal degeneration, it's way down at the very bottom edge. Nailing that location is absolutely crucial for getting the diagnosis right.
All right, so you have a diagnosis. Now what? This brings us to what's probably the most empowering part of this whole explainer, your treatment toolkit. Let's take a look at the range of options that are out there today.
Okay,
Before we get into any of the high-tech procedures or fancy lenses, listen up. This is the absolute #1 non-negotiable first step. Stop rubbing your eyes. Seriously, because the link between eye rubbing and this condition getting worse is so strong, stopping this habit is the single most important thing a patient can do. Period. Okay, so for just correcting the vision, the toolkit starts pretty simple. In really mild cases, glasses or soft contacts might do the trick. But for most people, the real game changer is rigid gas permeable lenses, or RGP lenses. These are hard contacts, and what they do is they vault right over that irregular cornea and create a brand new, perfectly smooth surface for light to focus on. They're successful in the vast majority of cases, and they can make vision crystal clear again.
But what if you want to do more than just manage the symptoms? What if you could actually stop the condition from getting any worse? Well, that's where these more advanced procedures come into play. These treatments are all about strengthening and stabilizing the cornea itself. And then for the most severe cases, where even contacts aren't an option anymore, a corneal transplant is the final step in the toolkit.
So let's break down the most common strengthening procedure, which is called corneal cross-linking. I know it sounds super complex, but the concept behind it is just brilliant. First, the eye is completely numbed and the very thin outer layer is gently removed. Then, they soak the cornea in riboflavin, which is really just vitamin B2, for about half an hour. Finally, a special UV light is shined on the eye, and that light activates the riboflavin, causing it to form new bonds or cross-links between the collagen fibers inside the cornea. It's literally like adding reinforcing steel bars into concrete. It makes the whole structure stronger and stops that bulging process in its tracks. So, with all these treatments, what does the future actually look like? Let's move into our final section, living with keratoconus and what you really need to know for the long haul.
Now, for the most part, keratoconus is a very manageable condition, but there is one rare but pretty serious complication you have to be aware of. It's a sudden event called acute hydrops.
Okay, so what is acute hydrops? It happens when a tiny rupture occurs deep inside the cornea, causing it to suddenly fill with fluid and swell up like a sponge. The signs are dramatic. You absolutely can't miss them. A sudden, severe drop in your vision, along with pain, a red eye, and extreme sensitivity to light. If any of this happens, you need to see your eye doctor immediately.
But now, this next point is incredibly important, so listen closely. This is a huge piece of reassurance. Even though it's a medical urgency, our source material is very clear. Acute hydrops is not a reason to rush into an emergency corneal transplant. It might look and feel scary, but it's a treatable condition that usually gets better on its own over several weeks or months with the right medical care.
And that really brings us to the key to long-term success. Living well with keratoconus is all about monitoring. It's about those regular follow-up appointments, maybe every 3 months, maybe once a year. That's what allows your doctor to track any changes with tools like that corneal map and adjust your treatment plan to keep your vision as clear and as stable as possible for years to come.
So we'll end on this thought. Procedures like corneal cross-linking, they were designed to fix a problem, to strengthen a cornea that was already weakening. But as we get better and better at this technology, you have to wonder, could some form of corneal strengthening become a routine part of eye care for everyone in the future, like a preventative measure? It's a pretty fascinating question to think about. Thanks so much for joining us for this explainer.